Hi, now we're going to see how to do a Donati stitch. The Donati stitch is a suture type used to close skin wounds, and it is very helpful for deep lacerations because it allows closure of both deep and superficial layers. It has a far, near configuration, which we will see now. So the far loop goes into the skin about half a centimeter from the skin wound and goes deep inside the dermis and exits the same way on the other side, deep from the dermis and out about 5 to 8 millimeters from the skin wound. And then you return the other way with the near loop, which must go very superficial and 1 to 2 millimeters from the skin wound, and also the same depth. And on the other side, the same way. It is important that both are symmetrical so that you can have a very nice apposition of deep and superficial layers. So once you get to the other side, you can tie your knot. Just with enough pressure so that your wound gets closed, and not with too much pressure because you have the risk of the suture cutting into the skin right here. So that's a Donati suture, Donati stitch. So this variation uses the same technique. It's the far, near, but instead of doing the far into the subcutaneous and the near into the dermis, you start the same way with your first far, which goes deep inside your wound. And then the second far goes inside the subcutaneous tissue, but then exits without exiting the skin. So it goes out right before the skin. So there you get your far and first near. And then you go back to the first side of the wound. And you exit the same way as the initial Donati. So this way, when you tie your knot, you don't have the risk of your suture going inside the skin on this side here. So that's the Donati stitch and its variation.